los temas de hoy son bedpan, o sea, la cuña, y ROM, Range of Motion Exercises, los ejercicios de rango de movimiento. Les decía que los ejercicios de rango de movimiento son para evitar que las articulaciones se contracturen, para disminuir un poco la atrofia muscular de los pacientes encamados y para evitarle los dolores que generan en los pacientes encamados la falta de actividad. ¿Okay? Entonces, por eso debemos hacerlo todos los días, 1 o 2 veces, de 5 a 10 repeticiones cada uno y en todas las articulaciones mayores. ¿Okay? Vamos a compartir un video donde van a poder ver este tipo de ejercicios para que lo puedan visualizar, porque es mejor verlo que explicarlo, ¿no? Y eso es que verlo y practicarlo en el laboratorio. Lo otro es que los videos que yo grabé para el examen de CNA, para la preparación del examen de CNA, son para el examen, pero no es para nada lo que hacemos en la vida real. En la vida real debemos trabajar un lado del cuerpo completo, cefalocaudal, es decir, de la cabeza a los pies, y después vamos al otro lado y lo hacemos completo. ¿Ok? Y son muchos más ejercicios. En el examen de CNA, esto sale fragmentado para que sea factible en ese examen, pero en realidad eso que se hace en el examen, si lo hace solamente eso, no es suficiente. ¿Ok? Entonces, a veces olvidamos un poco que la importancia que tiene esto y preferimos hacer otro tipo de tareas de cuidado del paciente, pero esto realmente es muy importante. El paciente que está inmóvil se va perdiendo la funcionalidad de las articulaciones y se va atrofiando muscularmente. Esto genera dolores y incapacidad después de realizar los diferentes movimientos que hacemos con el cuerpo, las extremidades fundamentalmente. Entonces, den la importancia. Lo otro es que hay 2 grupos de ejercicios. Estos se pueden clasificar en 2 grupos, los activos y los pasivos. Los activos son los que cuando el paciente puede ejecutarlo, hacerlos, tú le indicas cómo se van haciendo y ellos lo repiten, ¿no? Es como una clase de educación física, tú le vas diciendo, haz esto, haz este movimiento, y si lo hace bien, ok, eso sería activo. Y el pasivo es cuando el paciente no es capaz por falta de fuerza, porque no escucha bien las órdenes o no lo entiende, porque tiene, por ejemplo, una demencia. Entonces, uno es el que le hace los movimientos. ¿Está bien? Ambos son importantes. Ok, entonces voy a poner el video.
Range of motion exercises help prevent complications from bed rest and immobility. Range of motion is the amount of movement present in a joint or how far a joint can be moved without causing pain. When joints are put through the range of motion, the muscles are exercised. This is important for the prevention of contractures and muscle atrophy. A contracture is the abnormal shortening of a muscle. A contracted muscle is fixed in position, cannot be stretched, and is permanently deformed. The involved joint cannot be moved. This lady's finger cannot be straightened, and she cannot open her hand or straighten her wrist. She cannot use her hand or fingers. Another complication is muscle atrophy, which is a decrease in size or a wasting away of muscle. Atrophied muscles are weak and cannot function well. A person with atrophied leg muscles will have difficulty walking. Range of motion exercises help prevent contractures and muscle atrophy. Range of motion exercises can be active, passive, or active assistive. Active range of motion means that the person does the exercises without any help. If the person cannot move, the exercises can also be done by another person. These are called passive range of motion exercises. Active assistive range of motion exercises are when someone helps the person do the exercises. The doctor or nurse will decide the type of exercises to be done, how often they should be done, and which joint should be exercised. Range of motion exercises should be performed at least 3 times a day to maintain joint mobility. When you are performing these exercises, remember that every motion should be done slowly, gently, and smoothly. Do not move the joint past the point where there is resistance or pain. Support the limb and joint you are moving. If you notice that the person feels pain during any exercise, you should stop and report it to the nurse. Remember, always to use good body mechanics. If the exercise will be done in the room, knock on the door before you enter. Next, introduce yourself. If needed, identify the person. Explain what you are going to do. Wash your hands and pull the bedside curtain for privacy. Raise the bed to a good working height and adjust the head of the bed as needed for effective range of motion positioning. This will keep you from reaching too far and help you maintain good body mechanics. Lower the bed rail on the side of the bed that you will be working. Make certain the person's body is in good, proper body alignment. To organize the range of motion exercises, always begin at the top of the body and move down toward the person's toes. Do each motion at least 5 times. There are 11 basic movements to range of motion exercises. Abduction is moving a body part away from the body. Adduction is moving a part toward the body. Extension is straightening a body part, while flexion is bending a part. Hyperextension is excessive straightening of a part, and dorsiflexion is bending the part backward. Rotation is turning the joint, while internal rotation is turning the joint inward, and external rotation is turning the joint outward. Pronation is turning the joint down, and supination is turning the joint up. You will become familiar with these movements throughout the video.
Deborah begins by exercising Mr. Field's neck. There are 5 movements: flexion, extension, hyperextension, rotation, and lateral flexion. To support Mr. Field's head, Deborah places her hands over his ears. To flex the neck, she brings his head forward so his chin touches his chest. She straightens his neck for extension and then hyperextends his neck by moving his head backward until his chin is up. To rotate his neck, she turns his head from side to side. And for lateral flexion, she moves his head to the right and then to the left. Deborah then repeats this exercise at least 5 times. Next, she exercises Mr. Field's shoulder. There are 6 movements to these 4 exercises. First, Deborah supports his wrist with one hand and his elbow with the other. She flexes his shoulder by raising his arm straight in front of him and over his head. To extend his shoulder, she brings his arm down to his side. She abducts his shoulder by moving his straight arm away from his body and adducts the shoulder by bringing the arm to his side. To internally rotate the shoulder, she bends his elbow, raises it to shoulder level, and then moves his forearm down toward his body. She externally rotates the shoulder by moving his forearm toward his head. These exercises are repeated at least 5 times. Another shoulder movement is hyperextension. The person has to be standing or sitting in a straight-back chair for this movement. To hyperextend the shoulder, the arm is moved behind the body. Now Deborah exercises Mr. Field's elbow. Flexion and extension are the two movements. Deborah supports Mr. Field's wrist with one hand and his elbow with the other. She flexes his elbow by bending his arm so that he touches his shoulder, then extends his elbow by straightening his arm. Flexion and extension are repeated at least 5 times. Deborah exercises Mr. Field's forearm by using the movements of pronation and supination. She turns Mr. Field's hand so his palm is down for pronation and turns his hand so the palm is up for supination. The movements are repeated at least 5 times. Exercising the wrist involves flexion, extension, hyperextension, and radial and ulnar flexion. Deborah holds Mr. Field's wrist in both of her hands. To flex his wrist, she bends his hand down, and to extend his wrist, she straightens his hand. She bends his hand back to hyperextend his wrist. For radial flexion, she turns his hand toward his thumb, and for ulnar flexion, she turns his thumb toward his little finger. The 5 movements of flexion, extension, hyperextension, and radial and ulnar flexion are repeated at least 5 times. When you exercise the fingers and the thumb, remember to support the joints. To exercise Mr. Field's thumb, Deborah holds his hand with one hand and his thumb with her other hand. She abducts the thumb by moving it away from his index finger, and adducts the thumb by moving it toward the index finger. For opposition, she touches each fingertip with his thumb. She then flexes his thumb by bending it into his hand and then extends the thumb by moving it out to the side of his fingers. These movements are repeated at least 5 times. Range of motion exercises for the fingers involve 4 movements. Fingers are abducted by spreading them and the thumb apart, and adducted by bringing the fingers and the thumb together. Fingers are extended by straightening them, and flexed by making a fist. These movements are also repeated at least 5 times. Next, Deborah exercises Mr. Field's hip. She folds the bath blanket back to expose his hip and leg. To support the hip and knee during the exercises, place one hand under Mr. Field's knee and the other under his ankle. Range of motion exercises for the hip involve 6 movements. Deborah raises Mr. Field's leg to flex the hip and straightens his leg for extension. To abduct the hip, she moves his leg away from his body and adducts the hip by moving his leg back toward his body. She turns his leg inward to internally rotate the hip and turns the leg outward for external rotation. These movements of flexion, extension, abduction, adduction, and internal and external rotation are repeated 5 times. To exercise the knee, Deborah places one hand under Mr. Field's knee and the other under his ankle to support his leg. She flexes the knee by bending the leg and then straightens the knee for extension. These 2 movements of flexion and extension are repeated at least 5 times. There are 2 movements for the ankle. dorsal flexion, and plantar flexion. To exercise the ankle, Deborah places one hand under Mr. Field's foot and the other under his ankle. She pulls the foot forward and pushes down on the heel to dorsiflex the foot. She turns the foot down or points his toes to flex the ankle. The movements are repeated at least 5 times. Pronation and supination are done to exercise the foot. Deborah turns the outside of Mr. Field's foot up and the inside down for pronation. For supination, she turns the inside of the foot up and the outside down. Pronation and supination are repeated at least 5 times. Finally, Deborah exercises Mr. Field's toes. This involves flexion, extension, abduction, and adduction. She curls the toes to flex them and then straightens them for extension. Toes are separated for abduction and pulled together for adduction. These movements are repeated at least 5 times.
When you have finished with the toes, raise the bed rail and move to the other side of the bed and do the same range of motion exercises working from head to toe. When all the exercises are complete, Deborah positions Mr. Fields so he is comfortable. She adjusts the head of the bed to a comfortable position and places the call button within his reach and then unscreens him. Deborah remembers to wash her hands. She reports her observations to her supervisor and, if allowed, charts her actions and observations. This video has demonstrated the procedures for lifting and moving patients in bed, positioning, and range of motion exercises.
Uno de los procedimientos más largos es el de la cuña. Ustedes saben que para lo que es el uso de la cuña, ponerle la cuña a un paciente, uno no puede perder en la vida real tanto tiempo, porque entonces si el paciente se está haciendo sus necesidades, pues entonces vamos a llegar tarde, ¿no? Entonces, pero el protocolo del procedimiento es bastante largo. Ustedes, cuando uno lo estudia, se da cuenta que tiene cantidad de pasos y es uno de los más largos. Hoy lo practicamos en el laboratorio. Y realmente, a mí me parece que es el más largo de todos, por la cantidad de cosas que hay que hacer. Pero bueno, en definitiva, en la vida real ustedes saben que eso se va a virar al paciente hacia un lado, se le pone la cuña y se deja ahí, se le debe dar un poco de privacidad, se debe semisentar, o sea, poner en semifowler la cabecera de la cama para que el paciente tenga mayor comodidad a la hora de hacer su necesidad y luego tenemos que retirar la cuña con cuidado y limpiar al paciente, básicamente, ¿no? Asearlo y luego, bueno, ponerle su pamper o su ropa, lo que sea, según el caso. Debemos usar un pad de incontinencia para esto porque si no la cama se va a llenar de orina o de agua, lo que sea. También se usa la cuña para asear al paciente, o sobre todo a la paciente femenina. Se usa a veces para asearla, es muy práctico, puedes echar agua y lavar bien, y no solo con los wipes, ¿no? Entonces, sino con suficiente agua y jabón. Se prefiere para esto el jabón que es sin enjuagar, aunque enjuaguemos. Para que si queda algún residuo, nosotros vamos a enjuagar. Jabón sin de ese que se puede, pero si queda algún residuo no le queme. ¿Ok? Entonces, bueno, eso es la hora de clase que teníamos hoy. Voy a ponerlo luego. Si tienen alguna pregunta, este es el momento. Recuerden que el día 29 de este mes se va a cerrar la plataforma vieja y ya tendríamos que empezar a trabajar en la plataforma nueva. Por lo tanto, terminen todo lo que tengan pendiente ahí antes del 29, por favor. ¿ok? Porque seguro que el 30 ya eso amanece cerrado y ya no puedo entrar, no les puedo dejar entrar con la nota que hayan sacado, ahí va a quedar. Les da tiempo porque afortunadamente esta asignatura no tiene tantas evaluaciones y no son tan largas, entonces les da tiempo perfectamente terminar todo antes de esa fecha, ¿ok? Yo voy a abrir la última semana un poco antes para que ustedes puedan ir adelantando un poquito, pues, dada esta circunstancia, ¿ok? Porque ya la otra se va en la otra plataforma. Y luego las reglas de la otra plataforma yo se las voy a comunicar cuando las tenga todas, porque algunas cosas van a cambiar. La interfaz es la misma, vamos a ver lo mismo en la pantalla y todo, pero algunas reglas como la fecha en que se hacen las evaluaciones, que hay que respetar, va a haber una fecha de vencimiento de cada evaluación y esto vamos a tener que respetar esa fecha, entonces tenemos que ponernos más disciplinados que nunca cuando empecemos en la otra plataforma. ¿Okay? Bueno, un abrazo y nos vemos pronto. Cuídense. El próximo lunes vamos a volver a reunirnos acá, ¿ok? Cuídense, sigan trabajando. Bye, bye.
Noche, bro.
Bye.